Did you know that in the first 6 months of 2020, over $8.7 billion was spent on cosmetic plastic surgery? That being enough money to feed our 553,000 people in the homeless population of the U.S. for a month. That only costing $138 million, which is only 1.6% of the $8.7 billion spent on cosmetic plastic surgery in the first 6 months of 2020. Ultimately, these procedures were undertaken to improve individual satisfaction with their appearance and also in many cases their self-esteem. Cosmetic surgery can be considered psychological intervention or surgical procedure with psychological consequences. Beauty is not a valid reason to pursue cosmetic plastic surgery. There are many risks of cosmetic surgery, such as infection, body dissatisfaction, body disfigurement, or even permanent mistakes. In an article written by Rima Finkel, a medical doctor, Finkel lists the cons as well as few pros to cosmetic plastic surgery. In her list of cons were how expensive the surgery is, the rate of medical mistake, and physical and psychological consequences such as addiction and recovery time. One horrific example of medical mistake and body disfigurement is the story of Lindsay Colsmimo. Lindsay went to Mexico in order to undergo a cheaper breast augmentation. When arriving at the hospital, she saw how unsanitary the staff was and heard rumors that her doctor wore cashmere sweaters while performing the surgeries. Lindsay met with her doctor, who calls himself the surgeon of Barbies, and prepped for surgery. After surgery, Lindsay realized something went very wrong. She had lost her nipple, had a huge gash, and had another wound where her implant was tearing apart her breast. When asking the doctor about her results, he responded with, "It's like a snake. You will shed your skin and you will be fine." Lindsay was so worried that she sent pictures home to her regular medical doctor, and he responded that she needed to receive medical help as soon as possible. She was suffering from necrosis, which is the death of the tissue because of lack of blood flow. Lindsay is just one of thousands of patients who suffered the physical consequences simply to improve her breasts. In 2020, there was a total of 2,314,720 total cosmetic procedures ranging from liposuction to Botox to arm and thigh lifts in the U.S. Out of these 2 million procedures, 93.83% were temporarily satisfied with their results, that leaving 6.17% of patients unsatisfied with surgery outcomes. In the U.S., the 5 most popular reasons for choosing cosmetic surgery are because of more screen time, more acceptance, more affordability, health benefits, and the availability of technology in the field of cosmetic surgery. But with many wanted benefits comes many negative psychological and physical consequences. In fact, one study done by social worker Roberta Hongman and psychiatrists Catherine Phillips and David Castle found several predictors of poor outcomes for those who held unrealistic expectations or had a history of depression and anxiety. The researchers found that patients who are dissatisfied with surgery may request repeat procedures or experience depression or adjustment problems, social isolation, family problems, self-destructive behaviors such as anger toward the surgeon or his staff. Cosmetic beautification causes more dissatisfaction with one's appearance when the results are thought to be inadequate to the patient's personal standards. This self-dissatisfaction, caused in part by cosmetic plastic surgery, further drives development for health problems such as body dysmorphia, anorexia, anxiety, and depression. Both the statistics and many botched surgery stories demonstrate many health reasons why cosmetic beautification should be avoided. These statistics and numerous horror stories show that the current want for beautification via cosmetic surgery is not worth the long-lasting risks, both mentally and physically. More harm comes from cosmetic plastic surgery than good. Others will say that beautification through cosmetic surgery boosts self-esteem, self-confidence, including body image. Increasing body positivity as a result from cosmetic surgery is a common bandwagon. But many times, this logical fallacy's assumptions are not the case. Rather, it is more common for patients to develop body disorders such as body dysmorphia or addiction after receiving cosmetic surgery. I hope that I have convinced you cosmetic surgery is unsafe and hurts one's health rather than boosting it. Many people have suffered preventable consequences from cosmetic surgery, such as post-operative infection, low self-esteem, and body dysmorphia disorder. Many individuals have suffered from the physical and mental consequences of cosmetic surgery for beautification purposes. These consequences are preventable, untreatable, and should be avoided at all costs. Please fully consider and weigh the benefits and potential consequences of plastic surgery before making a decision to schedule that appointment for elective cosmetic surgery. Ask yourself, if this goes wrong, can I live with the outcome? I urge you to thoughtfully consider the research I have presented and even highly suggest doing some research of your own before undergoing a life-altering surgery. Thank you.